Hi, my name's Kinsey. So I went for a surgical mistake. I do work in surgery, so that's my bread and butter. Not the mistake part, but surgeries. So I found a story about Angela. I think she lives in the UK. She has an English accent. Didn't really tell me where she lives, but so she had started having pain. And she went in her stomach and her back. And so they diagnosed her with having gallstones. So they scheduled her to have a gallbladder removal surgery. She went in to do that. And the surgeon accidentally cut the I always get this word wrong, even in surgery, common bile duct, which is a big no-no. Like when we're in school, we learn you don't even get near it. Like you have help the surgeon to not even be near that. Yes, they are close, but it can cause a lot of serious issues. So they cut that on accident, and yes, they noticed the mistake right away. They transferred her to a sister hospital with a better team that would be able to help fix the mistake. But what had happened was she also got an infection, and so they had to start her on liquid IV, or not liquid IV, sorry, antibiotic IV. And yeah, but now she's saying life hasn't been the same. She has a hernia on where one of the scars are, and she has liquid stool 24/7. Like it never changes. She said she also, if she eats the wrong things, she can be in bed for 2 days, in a lot of pain and agony. So yeah, the one little mistake, and let me tell you that it is very tiny. Not the mistake, but the common bile duct is very small. I've been plenty of those surgeries and I've seen them. But it is very small, and surgeons now, the surgeons I have been with are like, okay, here's the common bile duct. We're going to move that out of the way. They purposely move that out of the way so it does not get nicked, because they know how serious it can be and cause for the patient. It can be life-threatening as well. So I know a lot of surgeons take it very seriously, which every surgeon should, but we are human error. Okay. Mistakes do happen. But yeah, so they caught it immediately, which is great. But I also looked up the short-term and long-term effects of what could happen. So, short-term effects are jaundice, intense pain, nausea, vomiting, fever, chills, bile peritonitis, which is when the bile duct is cut, it can leak. And the bile is very toxic to our bodies. So, and then long-term effects, strictures, so scar tissue can form at the site of repair, infections, gastrointestinal problems, which she does have, increased mortality. So it says that when the bile duct injuries require further surgical intervention, it's a higher long-term mortality care or rate. Anyway, so it is very serious, but this is why in surgery we have things now where we all do a timeout. We all make sure the patient's marked, the correct thing is marked, and it's trust me, we take it very serious in the OR. So yeah, that is a mistake.